The patient safety programme for us became the stepping stone for us to develop our understanding of the signs of improvement, for us to think about ways we could improve patient journeys. We could make things for patients happen quicker, more safely, and more focused around the patient. So what we've taken from that is our next stage of moving that on has been to think about how improvement can be embedded throughout the organisation, how our staff can be equipped to do this as part of their day job, not as an add-on. And I think, as I said earlier, that shift to improvement becoming a movement in healthcare is something that we strive for. For us, the next phase of development work is about creating our own capacity as an organisation to become sustainable, to the point that what we strive for is improvement becoming a movement in our healthcare organisation and something much more than a programme and an initiative. When we first started in patient safety, that involved the work of our patient safety teams, looking at reliability in surgery pathways, looking at reliability in how we managed medicines, for instance. We've taken that on now and have started to look at integrated patient pathways and how we can improve them. So we've done work, for instance, to reduce the amount of time a patient waits to be seen in a clinic by 8 weeks. We've moved onwards with our learning from patient safety to use that methodology to help us improve waiting times for patients. It's helped us improve how quickly patients can access their diagnostic tests, and on the back of that, how promptly we can ensure that they get feedback on those tests, that they can then go forward for treatment. The tipping point, I think, has a number of dimensions. The tipping point has in it skills and an understanding in our staff of the science of improvement and the profound knowledge that's needed to take tests to change forward and to try them. But the tipping point is also about culture. It's about a shift in the organisation where we spend our day talking about quality and safety and patient experience, and we find ways to do that in clinical teams. And the same way as before any operation starts, we see a safety pause which allows every member of a clinical team to stop, to make sure that they're comfortable with what they're about to proceed with. That's the nature of the dialogue that we believe is important in forming the tipping point. I think the focus is one about celebrating how far you've come, and although your campaign still has some days to run, that the evidence at the learning event today for me has shown that the teams are working hard to progress the safety work that they've started. The next steps, I think, are about focusing on incrementally sustaining that change and planning that this is something that you're committed to for the long term. And we've heard today about the 5-year plan, and I think that's a good framework to think about sustainability in that longer term past next April. I appreciate the difficulties and the challenges that are around all of us at the moment in terms of making sure that we deliver high quality services at a time when we have some fiscal challenges around us. But what's important is that even at times of great challenge, organisationally and clinically, we're focused on what matters. And that still remains to be the quality of the care we deliver for patients. And if that remains our centre of attention, then that's an important place to be.